is doing the dying, it shows the gender bias of HIV/AIDS, which is also extremely frustrating and quite terrible. Because to me, it tells me that HIV is a gender-based disease. Well, people get angry when I say it's a disease spread by men, but suffered by women. Because this is the age between 2 and 4. There are more males positive. When sexual activity starts, females start pushing up. Huge gap. In one district in the country, in 6 schools, the learners from grade 9 and 10, in grade 9 and 10, were tested. And 4% of the boys were positive, but 28% of the girls were. So this is the gap. It shows transgenerational sex. And later on in life, you can see the situation goes back to male. So during sexual activity, this is the problem. And I'll tell you why I emphasize this issue. Because it informs this one, which is very destructive on the health scene of South Africa. Both developmentally look from any direction. It compares us with Brazil in terms of distribution of death between in females between ages of 15 and 64. This is Brazil, which we regard as normal. That is Brazil in 2004. In 1997, this was South Africa. Much more, a little bit more like Brazil, but already starting to wobble. But by 2004, South Africa has completely changed. There were more females dying at 30, as there were. And we can't claim that we never knew about this. Professor Malagapuru Makgoba, who is now the principal of University of KwaZulu-Natal, in 2001, he was the president of the Medical Research Council. In the Medical Research Council journal, he wrote that something is killing young women. He never said HIV. He just said something is killing young women in South Africa, which is not in keeping with natural laws of biology as we know them. And I think he was describing this scene. There are 2 natural laws of biology, which this South African graph. This follows laws of biology. This doesn't. There are 2 of them. One is gender. The female species is supposed to outlive the male species at all times. That's not a law from me. It happened like that. From God. Sorry, males. Secondly, the issue of age. In the animal kingdom, you don't find the young dying as much as the old. But HIV/AIDS is starting to do that. Why am I saying it's important? In terms of education, if mothers die at this age, leaving children alone, you know they are living social problems. Crime, lack of education, teenage pregnancies, more HIV, drugs and alcohol, everything that is negative. That's why out of 1.3 million orphans in South Africa, most of them are maternal orphans rather than paternal orphans. And I also argue strongly that many males, their life just deteriorates when their wives die. It's not the other way around. There are many wives who lost their husbands. Life goes on. Normally, they can be able to keep their family.